Hello and welcome. My name is Mark Blatstein, the physician founder of Physician Pre-Sentence Report Service. I also have physician prison consultants. And today, whether you're facing indicted or going to prison or facing prison, you don't want to give up. So today's YouTube is strictly going to be directed at the CEO, COO of a hospital system or of a company that services the healthcare industry, manufacturer, life sciences, medical device company, genetic uh, gene therapy, whatever your specialty, you're not immune. I have Aetna on the phone. I have Aetna on the screen right now. Elevant, Cigna. The Department of Justice is an equal opportunity targeter, and their first target, as they spelled out in their memorandum, is going to be you, health sciences. And so let's see if I can. And here it is: prioritization, associated policy changes, criminal division, healthcare fraud, procurement fraud, and those that are in that particular healthcare space. So we're going to continue. The charges right now, as the Department of Justice has sifted almost all of their criminal charges to civil. So they're going after the money. But take these sellers seriously, and you need legal advice because a civil charge today can't become criminal tomorrow. So I wouldn't put anything over on what the Department of Justice will do or won't do. Um, it's a pretty interesting times we're living in. Should your charges, though, become criminal, doesn't matter whether plea or trial, consider engaging my services. I'd love to work with you. Your first conversation consults on me. Give me a call, 240 888 Let's get started. As I said, False Claims Act. And this has been, it's an overused term, kind of like the word respect, that expands into the white collar sector, this DEI thing, which I don't know that I agree with, but definitely should give everybody pause and everyone looking at your policies because it has humbled even the biggest beasts from Harvard to big law partners. From January 1 to May 31, the Department of Justice has reported approximately 128 False Claims Act settlements. So where are they going? Civil Rights Fraud Initiative. The memorandum directed the Department of Justice to vigorously pursue these false claim acts against any federal contractor or recipient of federal funds, meaning if you're in the healthcare space, hospital system, an individual who infringes upon the civil rights, or particularly the matters that concern diversity, equity, and inclusion, including race, ethnicity of national origin, which goes against everything we stand for as a country. But all of a sudden, that's turned upside down. But who am I to say? And it has gone ahead and instructed federal and state agencies to restrict access to medical treatments. But in this case, gender transition for minors, but even with parental consent. So today it could be medical treatments related to gender transition for minors. Tomorrow it can be, I don't know, your wife deciding to get certain types of medical treatment, and they're going to say no, not allowed. Scrutiny of hospital physician relationships that continues. Chesapeake Hospital was indicted for healthcare fraud involving unnecessary surgical procedures. I can open this up to you, but and you can read it on your own if you go to my post. But it was a hospital right here in this, state of Virginia. So you consider looking that on your own on their website. But the memo of this target hospitals and allow a physician to do certain procedures that really he shouldn't have been doing. The federal government's intense scrutiny of the relationships between hospital and physicians is set to persist long past 2025, and it's clear healthcare fraud abuse, as defined only by this Department of Justice, DEI, remain among the highest priorities for federal oversight. So they're really cracking down. They've taken, I believe it's close to 75% of the Department of Justice's white collar division attorneys, prosecutors, and moved them over to immigration and other stuff like this. By accurately reviewing these policies, it can ensure staff adherence. Providers can take proactive steps to enhance compliance. Healthcare fraud and enforcement under Trump version 2 Again, you can see this here. I have a link directly to focus on fairness, efficacy, and the fight against white collar crime. Well, not really. It's just going after healthcare. His nominee, we now come up against Miss Dr. Oz, and he wants to go ahead and he doesn't like traditional Medicare. He calls it dysfunctional. He wants to turn Medicare into Medicare Advantage for all, while simultaneously expressing strong disapproval for traditional Medicare. And so, what does that mean? Well, Medicare Advantage restricts essentially, Medicare Advantage is another word for health maintenance organization, an HMO. And it's where the HMOs were in the 1980s. Most of you don't recall that or not aware of it. In addition, healthcare fraud enforcement is going to include clinical laboratories will be scrutinized, particularly those involving diagnostic and genetic testing, which they're going to include medically unnecessary tests. Although I have to say that when I was a resident, when we did surgery, we did it would be a diagnostic unnecessary test today, but at the time we did a range of blood tests. So if unfortunately you were found to have another disease, that would stop the surgery. But today we do the bare minimum. And those unfortunate few don't get evaluated or don't, that if they have another medical ongoing problem, it may be missed. Additionally, Medicare payments for durable medical equipment and related medical supplies are frequently examined with a focus on billing practices, coding accuracy, and medical necessity, and potential kickbacks could compromise the integrity of the system. They have very good data analytics, otherwise known as AI software. Healthcare fraud in the courts. This is going to be interesting. It's crucial to meticulously assess these issues at every stage during the motion phase, trial, and then necessary on appeal. Fraud cases, especially those related to healthcare, frequently hinge on the complex questions that are of intent and best evaluated by a jury of one's peers. Specifically, this is United States versus Jeffries, which you can open up. But this healthcare fraud, the national healthcare fraud takedown brings up several other issues, as in Medicare Advantage, which they're under the gun because all of a sudden they're going to start looking at what's exactly being offered to the end user or the patient who used to have Medicare, but it's not. So they're going to be, I don't know how they're going to crack down on that. And United Healthcare, who is facing a plethora of litigation. I'm not an attorney, way over my head. My takeaway is my recommendations on risk adjustment coding. I've covered this, and I also have a direct link to the author, Angela Comfort. But we can jump right to this particular article. Essentially, they go into the broader landscape of what's going to be required in coding as we go forward. And quite frankly, it's going to be important to have overkill as you kind of dive into the nitty gritty of documentation, both in your practice and healthcare system, because the Department of Justice will be doing just that, because they have the software and AI, the intelligence, artificial intelligence to do just that. Commercial insurers are also particularly those managing these patient protection and Affordable Care Act marketplace plans that are heavily relying on risk adjustment payment models. So the evolution is already here. What does that mean is that these following next 11 items need to be part of your plan, your risk assessment plan. There needs to be a health information management team. Coding teams need to be looking into new territory. Document strategy integrity, chronic disease capture. Accurate coding is essential because all of these need to be going into much more detail. Clinical documentation improvement, expanding clinical documentation improvement beyond the inpatient, focusing on, as I said, the physician office, the clinic, telehealth visits. Very important to be documenting these telehealth visits. Visit pre-planning, so that you have a record that you're going to follow up with the patient, especially if it's telehealth. Chart auditing regular. That's important because you need to make sure that we're not using templates that say the same thing every time. Advanced data analytics and artificial intelligence, AI-driven coding support tools can greatly assist, but guess what? They do not replace clinical judgment. The integrity of the data still remains a human responsibility. Conclusion, risk assessment has matured into a niche Medicare concern and a new universal driver of revenue, compliance, quite frankly, keeps you out of legal mumbo jumbo, legal complications with the Department of Justice. It appears to be a legal necessity. It's important to underestimate the significance. It's important not to underestimate the significance of your hard work and meticulous attention to detail. However, only after your counsel, who now feels a newfound confidence after thoroughly reviewing all of your records, will you truly understand the power of your efforts. This preparation will be invaluable as you head into your next meeting with the Department of Justice, reinforcing just how crucial this dedication will be. Again, while the charges may start civil, they want the money, but take it seriously. You need legal representation, because that legal charge today can be criminal tomorrow. If the charge turns criminal, whether it's plea or trial, consider engaging my services. The phone call is free. It's on me. My name, Dr. Blatstein, physician, pre-sentence report service, physician, prison consultant, white collar sentencing mitigation. And this is kind of an overview from their latest fraud takedown across all 50 states and the financial loss right here. I appreciate you taking the time to listen. I realize it's been a bit of a lot of information, and I'm grateful for your time. Hope you have a good day and stay safe.